My name's Robert Gillies, I'm a doctor at the Alfred Hospital and I'm a social entrepreneur. Social enterprise is the most effective way to raise money for charity in my view because it engages donors as well as creates meaningful change for people experiencing disadvantage in our community. So at Monash University I studied medicine and philosophy. My passion for charity work really began when I read the book The Life You Can Save by Peter Singer, who's a Monash alum. The book spoke about how really little gestures or even tiny amounts of donated time, energy or money can have a massive impact in people's lives. So I decided that I actually wanted to get out there and do a little bit more and that I had more to give. Dream Larger was a charity that I started with a group of medical students. It raised money for grassroots Indigenous educational, health and leadership development programs in Southeast Asia. I also spent a lot of time working with soup vans and going around the streets of Melbourne at night distributing food and resources to the homeless community. For me, there was always something that was unfortunately a little bit undignified about giving away second-hand clothes that were often torn, they didn't fit properly, but also it was often under a bridge at midnight. I wanted to create a way that we could give clothing in a more dignified way. Suddenly it clicked and I knew I wanted to be a social entrepreneur. Homie's a streetwear clothing store that uses 100% of its profits to deliver brand new clothing, training and job opportunities to young people affected by homelessness and hardship in Melbourne. I love social enterprise because there's no more rattling a donation can. People want to give and they give generously because they get something in return. Social enterprise is highly effective really because it's scalable, it's sustainable and it's highly engaging to donors. So at the moment I'm studying a Masters of Psychiatry at Monash University and I'm finishing off my specialty training to become a child and adolescent psychiatrist at the Alfred Hospital. Working with young people, there's so much hope. They're young, they're resilient and their whole life's ahead of them. And it really sort of mirrors the social enterprise scene in that way. There's energy, there's hope, there's goodwill. I find that aspect of the job really energizing.